Hi Kaki Watsons! Thanks for tuning in Stay Healthy with Watsons. In today's expert tips, we would like to share about musculoskeletal health. Today we are so honoured to have Dr. Sureisan, an orthopedic surgeon from Pantai Hospital Kuala Lumpur, to understand about aging in muscles, in bones and in joints. Welcome, Doctor. Doctor, as we age, I'm sure our body go through wear and tear. Can you share what to actually expect?
When we age up, what happens is becomes a bit sedentary. That means we do less activities. So we know all the tissues in the body, you need some stimulation to get it work. So it becomes sedentary, the muscle loses the strength. So in general, the strength of the muscle becomes weaker. So you need more effort to do some activities. And at the same time, you also tend to lose like balances and all those things because you're unable to maintain the posture. So there's an increased risk of falling off and all in older people. When you talk about aging in bones, we generally talk about bone density. So this comes to a condition we call as osteoporosis. So initially, when we are young, we have a high density of bone. Until 20-30 years old, we have very good bone strength. So later, when it's around 40, this becomes stable. But on 50 onwards, you can see some deterioration in bone density. So when it comes to 60, we start to lose more bone density. So especially in females, where they can lose around 5% of bone within 2 years when they have menopausal, during the menopausal time. So this causes fragility. That means the bone is easier to break off because the density of the bone is not there. So when they have a trivial fall, like just say in a spine, just say here, they tend to have fractures, what we call as osteoporotic fracture of the spine. And they can also have fractures on the hip joint down there. And also, there's another condition where they tend to fall on the hand, outstretched hand, and they have fracture over the wrist joint. So these are common things in older people where they have fragility fractures, we call this. So in normal young people, we have joint pristine, nice like this, no pain, nothing. Yeah? But when we age up, what will happen is the tendon become dehydrated, so it loses flexibility. The cartilage gets worn off because there's less water, so the cartilage become brittle and it worns off and exposes the bone which rubs over the other bone. So this causes pain, and it comes with inflammation of the surrounding tissue we call synovium. The synovium can become dehydrated, causing less fluid in the joint. When there's less fluid, there's more friction. So it's a vicious cycle causing pain over the knee joint. This condition in the advanced stage we call as osteoarthritis.
How do we actually take a better care of our musculoskeletal in lifestyle?
When we talk about aging process, so far we don't have any reversible possibilities, but we can always age gently. That means without pain, without discomfort. So you know the muscle, how can we prevent worsening of the muscle? Exercise of the muscle. So there are few types of exercises available. Firstly, stretching exercises like yoga. Secondly, stability exercises like Tai Chi, square dancing. Thirdly, weight-bearing exercises. So these weight-bearing exercises will increase the muscle strength of the muscle. So there will be more tissues forming around and it will prevent fall in older people. So how to prevent osteoarthritis? Exercise. We always teach strengthening exercises of the knee joint, quadriceps exercises for the knee joint. And we advise patients to use non-weight bearing or low weight bearing exercises like cycling or swimming. Don't do weight bearing exercises like jogging and all those things. That will worsen the knee. By exercising, you are building muscle around that area, strengthening the ligaments and the tendons. That will prevent further injury. Okay. Thirdly, if we have injured knee or joints at early stage of your life, like during your 20s, 30s when you're active, take urgent attention, seek doctor's opinion. If there's a meniscus or ACL injury, that can be corrected early. That will prevent progression for osteoarthritis later. So these are three things that you need to look for the joints. And now we come to bone. How to prevent aging of the bone. So when there's density reduced in bone, we call it osteoporosis. How to prevent osteoporosis? Firstly, healthy diet. That's the most important thing. Yeah, fresh fruit, fresh vegetables, grains, these are very important. Take adequate intake of calcium. So where you get calcium from? From the diet, sardine, spinach, yeah, so almonds, very good. Yeah, these are the high content of calcium. Thirdly, vitamin D. There's a lot of available supplements, vitamin D supplements over the counter. So we need to avoid smoking. Smoking kills the cells that produces bone. So avoid smoking. Limit the intake of alcohol. Limit caffeine. And then exercise. For osteoporosis, you need to do weight-bearing exercises, not low weight-bearing exercises. Weight-bearing exercises, because the more stimulation to the bone-forming cells, will form more bone, less resorption of the bone.
Hello Kaki Watsons. Parents are important people whom unconditionally take care of us. As we are growing stronger by days, our parents are getting older by days too. So, love your parents.
Today, we will learn some simple ingredients that can be found in this recipe that are good for your bones. Recipe number 1, cocoa, cherry, oatmeal. So first, boil 500 ml of water and add in a cup of oat, 200 ml of oat. Add in some half a teaspoon of Himalayan salt, and you can stir occasionally. Cover and let it simmer for about 15 minutes and add in some milk. Next, you can add in some cocoa powder, 2 tablespoonfuls of cocoa powder, then a teaspoon of cinnamon. Remember to use low heat when you blend the powder in. And now you can add in the dry ingredients. So add in half cups of the dried cherries, the blueberries, and the cashew nuts. And stir well. And now it's ready to serve. And you can use some honey to taste and sprinkle some pumpkin seeds on the top. There you go, the cocoa cherry oatmeal is now ready. And the second recipe, the anti-inflammatory shake. Make the shake, you need first of all a shaker and pour in a 250 ml of milk. Next, get a kitsui sachet. Next, you can use the cinnamon powder. Half a teaspoon of the powder is sufficient. Then the turmeric powder, half a teaspoon as well. And this is the grinded sunflower seeds which we have grinded beforehand. You need a tablespoon of this, a teaspoon of chia seed, and lastly, you can add some coconut oil, a teaspoon of coconut oil. And close the cover, shake well, and it's ready to serve. Ta-da! It's done!
Hi Kaki Watsons! To keep your muscle, bone and joint strong and healthy, starting with Blackmore's glucosamine 1500 mg. These supplements help to replenish our joint cartilage and synovial fluid. It is a safe and effective treatment for osteoarthritis to prevent wear and tear and reduce inflammation and pain in joints. Researchers found that there was a 50% improvement in pain and mobility after a period of 2 weeks using glucosamine sulfate at a dose of 1500 mg per day. It is clinically proven positive results within 2 weeks. It is also recommended to take glucosamine as a prevention, even if you don't experience joint pain. Looking at healthy bones, preventing osteoporosis is important. Adding calcium supplements such as Watson's Calcium Vitamin D3 help to promote stronger and more resilient bones and muscles. It contains the most clinically proven concentrated source of natural calcium elemental. With added vitamin D3, it ensures maximum absorption of calcium. For those who need a higher calcium count, Caltrate 600 Plus D is a health supplement recommended to support strong bone health. It contains 600 mg of calcium to help maintain strong bones, and with vitamin D to help your body absorb calcium. As addition, Caltrate 600 Plus contains additional minerals such as zinc, copper, and magnesium to support mobility. Besides having a balanced diet, always practice an active lifestyle such as walking, dancing, or low-impact aerobics. This daily gesture will definitely improve your bone and joint health. That's all for today. Let's stay healthy with Watsons.